into this new model of healthcare payment. Government payment is going to just continue to be bigger and bigger, whether it's on the Medicare side of our world or whether it's on the Medicaid side of our world. It's going to be bigger and bigger as a percentage of our total book of business. And when we're dealing in the government space, it's all about, or a lot of it is about risk adjustment and coding correctly so that we're able to get an adequate amount of revenue in from the government to basically take care of all the sick members that we care so much about. So ultimately this is about getting the revenue that we need in order to take care of the folks that are in our offices every day. So with that, I'm going to shift gears and talk a little bit about the star rating program. This is a program that CMS started in 2008. They started collecting data in 2008 from health plans that were in the Medicare Advantage space. There was no reporting of there was no public reporting until 2010, or was it 2009? Yeah, I think they may have done some public reporting in 2009, and then it really took off in 2010. And the star rating program is the quality program. It's our measure of quality of care. The first segment was on coding. This is on the quality piece. And our health plan currently, it's a 5-star rating system. And our health plan currently is 4.5 stars out of 5 for the HMO and PPO. There are actually 51 measures, and when you look at how these measures come about, they have different rating systems. The HEDIS system is responsible for some of those 51 measures, and you all are perhaps familiar with the HEDIS data set in NCQA. That's the Healthcare Effectiveness Data Information Set, the HEDIS set. And then the CAHPS survey is the consumer assessment of healthcare services, healthcare providers and systems. That's the CAHPS survey that's done each year. And that's a mailed survey that is where members are randomly selected to receive that satisfaction survey. There's also an assessment by CMS of some of our administrative measures, and there's also a domain where they look at health outcomes survey. Literally what CMS does through a vendor is they will randomly select members out of certain cohorts of disease categories, and they will follow up with them. They'll follow up with them initially, and then they'll follow up with them later on the next year, and they will actually look for specific health outcomes, and that actually enters into the star rating system. So it's a complex process, and it is directly related. So it all feeds into what our stars what our star rating actually is, and that also it gets coupled with the reimbursement model, which I'll explain to you in just a minute. So there are 500